First tonight, another record when it comes to newly confirmed COVID cases in Indiana. Today, the Indiana Department of Health reports 15,277 new coronavirus cases, which stretch between December 27th and January 5th. That's a record number of new cases on a single report here in Indiana.
Data also shows that as of yesterday, more than 3,300 people were in Indiana hospitals for COVID-related reasons. That's the highest number of COVID hospitalizations since December 2020.
But while we have a record number of new cases, in some instances nearly doubling the number of new cases we had on a single report this time last year, we have not hit a record number of hospitalizations.
Tonight, WRTV's Nikki DeMentri goes to the experts to find out if that could be a sliver of good news in the fight against COVID-19.
It's really hard to know the full kind of, burden of disease.
Indiana is consistently setting records when it comes to single-day case COVID-19 numbers, but the number on the state's website isn't painting the full picture.
For example, if our new count is around 12,000, we probably could estimate that there could be anywhere from 3,000 to 5,000 additional cases out there that are not being reported because of home testing.
Hospitalizations are inching closer to its record set last November, when cases were lower than what the state is seeing right now. Dr. Brian Dixon with the Regent Street Institute says there's two reasons why this is happening.
Individuals who are between sort of 18 and 40 years of age are driving this new wave. And those individuals, as we know from multiple studies over the last 2 years, they're at lower risk of hospitalization. The other factor is there is data now, particularly coming out of the UK, that suggests Omicron is not as sort of serious in terms of your consequences from the disease as the other variants.
Cases, hospitalizations, and mortality rates will continue to climb as peak isn't expected until the end of this month.
Businesses can't hire enough workers, as many as they would like right now as it is. And so what's happening is the current workers are getting overstretched, and they're either legitimately getting sick, but also they're just overtaxed and they're taking time away.
From airlines to retail, COVID-19 is creating a domino effect on the business world.
In the past, a lot of businesses are open as long as there are customers there. Restaurants will stay open late. They're open 7 days a week. Now we're seeing a new normal.
Economist Kyle Anderson says a new normal means scaling back services and operations. Month after month, data shows record number of people are leaving their jobs, only adding to the challenge.
These effects that we're seeing in the larger economy, we're going to continue to see over the next several weeks. It's not forever. It's for sort of this month or so while we go through our cycle with Omicron.
Working for you, Nikki DeMentri, WRTV.
Now, Dixon says the reality of record high cases and slower to rise hospitalization rates in Indiana is a case study for vaccine effectiveness. He notes the challenge now is getting the 40% of Hoosiers who are unvaccinated fully vaccinated.